Good afternoon, everyone. Eric Wilson with iCell Health Incorporated. Hope you're having a fantastic day. We continue our insurance training, and this week our topic is Medicare, Medicare products, Medicare supplements, Medicare Advantage. What is Medicare? Everything you need to know. Medicare has an open enrollment season every year, beginning in October, runs through middle of December, actually December 7th, and that is for Medicare prescription coverage as well as Medicare Advantage, which is sometimes called Part C, which you'll see on this board. So let's get to it. Medicare Part A is your hospitalization coverage, inpatient stuff. Part B is outpatient, MRIs, CAT scans, doctor visits, and Part D is your prescription coverage. Part A, you've been paying for that your entire life, your entire working life, so it's coming out of your paycheck. So now you don't pay any more for that. Whether you live to be 67 or 107 or 127, you don't pay for that anymore. Your outpatient, your Part D premium, that comes out of your Social Security check, generally speaking. Used to be $98 a month. Now it varies based upon your income. It could be anywhere from $98 to $198, depending on how much money you currently make in your retirement, your semi-retirement, or if you're still working or not working. Your intangibles there. Prescription drug coverage, that's your Part D. That has a premium generally somewhere, depending upon the plan, anywhere from $11, $12 all the way up to $90 a month. Depends upon what drug you're taking, and that's a little more complicated, so we'll spend a little more time on that later in the week. Let's talk about your Part A, and B for that matter, but Part A has an $1,165 deductible. That is and then it pays about 80%. And Part A is a little more complicated than that, but it'll pay $500 for this service and $280 for this service and 2 pints of blood for this service. But simplified for this discussion, about 80%. Part B, it is 80% of your outpatient stuff. So on top of your deductible is $140, and then if you have an MRI or a CAT scan, it costs us to say $3,000. You'd be paying 20% of that. Medicare would be paying 80%. Medicare Part C is sometimes known as Medicare Advantage. That is a kind of like a Medicare run by private insurance companies, where you take Part A and Part B, and they call it Part C. But you're still in the Medicare system. It has some added advantages. It covers a lot of the gaps that Medicare doesn't have, original Medicare doesn't have. But there are still some gaps in that as well. There's a lot of things that aren't covered by that. And then there's Medicare Supplement. Medicare Supplement generally fills all of this, depending on what Medicare Supplement plan you opt for, will cover all or most of the gaps in the Medicare plan. Excuse me, original Medicare. I say about 20%. So if you have a $100,000 surgery and you just have original Medicare, you're going to be paying about $20,000. With a Medicare Supplement, you will pay probably zero or very close to zero. If you have let's say you have Plan F, which covers everything. If you have a Plan F, you won't pay a dime for any services there. If you have a Part G or a Plan G, excuse me, all you would pay is $140 outpatient deductible. And if it's $100,000 surgery, it's inpatient, so you don't have to worry about that either. So some nice ways there. If you have a Medicare Advantage plan or a Part C, that varies as well, but most of them have like either a $3,500 out-of-pocket maximum up to maybe a $6,500 maximum. So that's not bad either in the grand scheme of things. That's not convenient necessarily to have a $6,500 bill, but in lieu of paying $20,000 on a $100,000 surgery, that's not too bad either. So we'll get more into this later in the week. Tomorrow we're going to talk about Medicare Supplement and Medicare Advantage. Also have an article on my website, www.icellhealth.com. If you just do a search for USA Today article, there's a lot of information there on Medicare Supplements and Medicare Advantage. We're going to get into that later in the week. I'm Eric Wilson. Have a great day.